So do you rely on reading glasses to help you see up close, such as looking at your smartphone, a computer screen, medications, or food labels? Or perhaps you have about 20 of these thrown around the house and your office. If this sounds like you at all, you are not alone. But thankfully, now we have an eye drop to help you with this problem. This eye drop is called VUITY and has been approved to treat presbyopia. But before you throw away your reading glasses, let's review how VUITY works. Is it going to be right for you, the price, as well as the potential side effects, because they are some you definitely want to know about. Let's take a look. Hello and welcome, this is Dr. Alan here from the Dr. Eye Health Show, helping you learn all about the eyes, vision, and finding the best vision products. Now, a major milestone in a lot of people's lives is when they first end up going to the eye doctor and they are told the bad news that they need to start wearing reading glasses, getting the cheap over-the-counter ones, or they need something like bifocals in their glasses. But this requirement happens for pretty much everybody once they hit about the mid-40s and above that because of a condition called presbyopia. Presbyopia is the medical term that we use to describe the change of the flexibility of the crystalline lens inside of the human eye. When you're young, the crystalline lens inside the eye is nice and flexible, but as you get older, that lens starts to harden and then you can't focus as well. That makes things up close really difficult to see. And for almost everybody, this starts again around the early mid-40s. But again, now we have this new eye drop called a VUITY, which is supposed to help us with this problem of presbyopia, and hopefully not need reading glasses as often. So how does VUITY work? Well, VUITY's main active ingredient is 1.25% pilocarpine. Now, pilocarpine has been in the eye care world for a long time, mainly as a glaucoma medication. But the VUITY eye drop in this case causes the iris, the colored part of the eye, to constrict, causing your pupil to become a smaller and smaller diameter. And by decreasing the pupil size, you increase what's called the pinhole effect. The pinhole effect works by making the pupils really small, eliminating all the extra stray rays of light that may enter the eye, and which increases your depth of field, or essentially increases your range of clear vision. As an example, if you take a camera with a very wide aperture, similar to having a dilated pupil, you may still see an object sharp in your image, but things way up close and things behind it are often going to be blurry. Like in this video, you have a blurry background. That's because the aperture in the lens I'm using is pretty wide open. But if you were to take that same lens and get a really tiny aperture, then all of a sudden you can start to see not only me, but you can see things in the foreground and things in the background all be simultaneously in focus. That means you've increased your depth of field and, again, your range of clear vision. But the way the eye drop works is you put one drop into each eye. It should start working even within about 15 minutes and should last somewhere between 6 to 10 hours. Now, what's really important about the VUITY drop and the FDA studies that were done to approve this medication was that this eye drop improved the participants' near vision by 3 lines without decreasing their distance vision by any more than 1 line. And those tests were done even in kind of a dimmer setting, which means that most people who are prescribed VUITY should start being able to see up close a lot easier, to see things like their phone, and at least anecdotally, I've heard that people are really doing well seeing their computer screen, again, without having to rely so much on reading glasses. Now, a great question is, who is VUITY really for? Now, the clinical studies called the Gemini 1 and Gemini 2 studies largely brought on people of ages in their 40s to their mid-50s. So people in that age range are probably going to respond best to VUITY. But presbyopia affects everybody differently. So some people in their late 30s all the way up to their early 60s perhaps may have a benefit using VUITY. However, at that same note, if you are somebody who requires a really strong power in your reading correction, or you are looking at really small details really up close, then you may still require some form of extra magnification, whether that's with reading glasses or maybe a magnifier or something like that. But the ideal candidates are people who are largely emmetropic or don't require glasses full time, including anybody who is post-LASIK. These may be individuals who will do very well on something like VUITY. Other than that, I've also heard doctors pretty interested in how VUITY may help people adapt better to multifocal contact lenses, as well as possibly using this to help reverse the dilation process that we use in the eye clinic, because we want to give people a good eye exam and nobody likes having their eyes dilated, but maybe off-label if we use VUITY, maybe it'll constrict those pupils a little bit faster. Maybe. We'll see. Now, in order to get Vuity, it is a prescription-only medication here in the United States, so you do need to talk to your doctor to get a prescription for it. Otherwise, you go to the pharmacy, and it should cost you somewhere around as low as $79 US for a 1-month supply. And sadly, because it's not considered medically necessary, it is currently not covered by insurance. Now, in case you're wondering, or if you're an eye doctor friend of mine who happens to watch this channel, you may be thinking, hey, pilocarpine has been around forever, right? And it no longer has a patent, so why would we prescribe Vuity specifically as a 1.25% pilocarpine formulation versus just a 1% pilocarpine formulation that's been around forever? I think you can get 1% pilo at a 10 milliliter bottle for something like $15, where again, Vuity as a small bottle only lasting a month is like $80. Well, in fact, Vuity has a special additive to it called a carrier molecule, which is called Fast Tech, which Fast Tech helps improve its bioavailability as well as its tolerability, meaning people have less side effects when they're using something that has Fast Tech in it. It all has to do with pH balances and how that medication ends up on the eye. Now, with that being said, pilocarpine does have some known side effects, and I think it's really important to know those before you start something like Vuity. But before we go over those side effects, let me know in the comment section, number one, are you using reading glasses, bifocals, multifocal contacts? What are you using? And two, if you are using Vuity right now, if you've tried it, let us know your experience with it so far. Yay, nay, what do you think? Now, there are 3 major side effects I want to talk to you about when it comes to using Vuity and other pilocarpine medications. Number 1 is the most common side effect, and it occurred in about 15% of participants taking Vuity, and that is headaches. So if you do take Vuity and you end up getting a mild headache, do not be surprised. However, at least in the studies, less than 0.5% of all participants getting headaches ended up deciding that was too much for them, and then they quit. So it sounds like the headaches are not that bad. The second most likely side effect is that of conjunctival hyperemia, or having just a redness to the eye. And the side effect that I think most eye doctors want to kind of pay attention to is that of potential increased risk of retinal detachment. Now, don't back off right away because you heard, oh no, retinal detachment, I've already got floaters, I don't want to have this. This is something that is at least reported with this class of medication. Again, pilocarpine has been around for a long time, mainly for glaucoma, and there are reported studies of patients who are taking pilocarpine who ended up having retinal tears and eventually retinal detachments. So at least pilocarpine eye drops are associated with these potential side effects, which I think is a good reason why this medication should be something that is prescribed by a doctor, because that gives them a chance to look at your eye, give a thorough eye evaluation, and if you're at risk of things like a retinal tear and detachment, then perhaps your doctor can say, you know what, I'm sorry, but this medication's just not for you. But thankfully, side effects such as retinal detachment from pilocarpine use is considered a rare side effect. But still, it's a potential side effect and a very serious one, and I want you to know about it. Otherwise, as always, if you're interested in something like Vuity and you want to learn more, I'll put some links in the description below. Talk to your local eye doctor if you want to try Vuity and if it's somewhere near you. Otherwise, thanks so much for watching. If you enjoyed this video, learned something new, hit the like button for us. Subscribe to the channel if you are new. Again, this is Dr. Allen. Thanks so much for watching. Keep an eye on it, and we will talk to you soon.